These skills, you can't learn that from textbooks. If you keep your outside calm, we will not bleed that stress into others.
Dr. Anjana Amarasekera, an emergency staff specialist.
I'm a bit of an adrenal junkie. I'm not hesitant to get my hands dirty with a good way or bad way. Every moment is a learning opportunity, and every time you learn something new, you are upskilling yourself. A wee bit, but you're a better person than yesterday. Don't be hesitant to come out of your comfort zone. It's a messy area. Emergency medicine resuscitation room is highly uncontrolled situation, and you need to bring that under control. However, when I walk into resuscitation room, I go into kind of trance. I wipe everything out of my head. At a glance, we knew that this child is in a very bad shape. We failed. He passed away. That day was my worst day. I couldn't keep it to myself. That day was so overwhelming to me. That moment was one of the most striking situations because she said, I probably have 2 more months to live. Thank you very much for giving that opportunity. Somebody is comfortable after your treatment. That is the ultimate goal.
Anj, thanks so much for coming on today.
Thanks for inviting me.
Yeah, not a problem. So Anj, I want to jump straight into it. First, if you don't mind, would you be able to give us a brief sort of introduction just of your journey as an emergency medicine sort of specialist? Where did you study? How was that training for you? And now being a boss, what's it like?
It's a big journey. I'm a Sri Lankan
Yes.
by birth, and my initial education was in Sri Lanka until my medical graduation. After graduated from University of Colombo, Sri Lanka, as a young medical professional, I moved myself to United Kingdom and got my next stage of training over there. That's foundation year 1 and 2.
Right.
Which is equivalent of the internship and the first year as a resident medical officer. And then I moved to Australia, and here I am. So first job I landed here as an emergency medicine senior resident, and I completed my training as an emergency medicine physician in 2016.
Why did you choose emergency?
Well, I was a medical person from my university time.
Right.
However, back in Sri Lanka, we have a big deficit in emergency medicine because we did not have the specialty, as the post-graduation opportunities were zero. The emergency departments were there, but looked after by other critical care specialists, like the intensivists, as well as the anesthetists.
Yeah.
When I moved myself to United Kingdom, and I saw how emergency medicine looked like, and I knew the importance of emergency medicine, how much they can add on to the critically unwell patients, especially in the early stages of that thing. So, which is a new area for me, which I never experienced as an undergraduate. I never had a chance to work on that. In England, I did not have the chance to be a part of emergency medicine. I always did the clinical medical stuff with the other specialities, medical specialities. However, when I came to Australia, the first rotation I landed on was emergency medicine. That's my first opportunity to experience emergency medicine. And that moment, I fell in love with it. So I thought this is my specialty, which I had always this small seed growing in there. And now I landed on that field. So I thought, this is it.
Is there something specific about it that you really sort of enjoyed? I remember we spoke about once how you told me you switched between seeing a cardio problem to a gastro to an ONG problem.
I'm a bit of an adrenal junkie. I want excitement all the time.
Right.
So during my residency, I did rotations in various areas, like surgical, vascular surgery, which is a very highly specialized area. I did trauma and orthopedics rotation. I did 2 rotations of general practice in rural England.
Oh, God, that would have been interesting.
So, and this is all part of the training in first 2 years in England.
Right.
Everybody has to go through these rotations. And then then I started doing emergency medicine. I felt it serves towards my adrenal craze and this excitement you get, and also that feeling that you're practically doing something. I'm a very handy person as well.
Yes.
I want my hands get dirty all the time.
Yeah.
I'm not hesitant to get my hands dirty with a good way or bad way.
Yeah.
So I felt it gives me the opportunity to do that. And also the exact thing you said, that being not an expert on one thing, but be a jack of all trades.
Yeah.
Simple as that.
Yeah, I remember you telling me that. I went home and thought about it, and I was like, I actually love the feeling of being a jack of all trades, just because I feel it, like, for me personally, it made me feel more comfortable with different situations. Whereas I remember when I did like 6 months of psychiatry, and then coming back into medicine or surgical things, it was very overwhelming because you don't have experience with those things anymore, right? Whereas in an emergency, it seems like you have lots of experience in different things, and so you're more comfortable with those scenarios.
If you're comfortable in getting yourself out of comfort zone, that is one big thing in medical or any profession. If you're thinking about upgrading yourself, upskilling yourself, don't be hesitant to come out of your comfort zone. Unless you get your feet in the water, you don't know how deep it is. And experience that. It will leave you with lifelong experiences that will make you a much better person.
Do you think that's something that's led to your sort of success in progressing in your career, is your ability to put yourself in uncomfortable situations and then learn to sort of swim in those situations?
Every time I come across that something I don't know, I challenge myself. I'll be a better person tomorrow.
How do you do that practically? I feel like people have that, but then they quit or they give up because it's too hard. Like, what do you tell yourself when you're going through something like that and it's quite overwhelming and quite challenging? How do you make sure you're persisting with it?
Most important thing is to get rid of the superego in you. Being a medical professional, we are sort of groomed into that, unfortunately, that to pursue as you are one of these superhumans. You are not a superhuman. I'm not a superhuman. I'm also one of those normal people living in this planet. And we all have good things, bad things. We all have strengths and weaknesses. Understanding your strengths and let them get stronger, and understanding your weaknesses and try your best to not to let them thrive. That is the most important part. With ego, superego I would call it, that is what destroys you. If you leave the ego behind, you always have that feeling to upgrade yourself. So when you do that every day, even now as a specialist, I see something that I don't know. It motivates me towards learning that thing. And not only learning that thing, but also to get that knowledge passed to someone else as well. So not to keep it to myself. And that makes me a better person if someone pursues it that way. And I do it every day. Even from the very first experience I had, I can give examples in my life. When I first joined here, I was started in one of the suburban hospitals in New South Wales. I had a situation where I couldn't get a cannula in a patient. I knew at that time you can use ultrasound scan for that. The emergency medicine ultrasonography was at very early infancy.
Right.
But there was an ultrasound machine in that particular emergency department.
Right.
I never done it before. But I took the machine to the bedside, and I thought I better have a look at the blood vessels, how it looked like. Not to do it, but to have a look at. When I was trying that, one of the senior clinicians came to me and asked, "Have you used this machine before?" I said, "No." So he said, "Don't use it then, because this machine is an expensive machine." I felt very upset if I said, "No, I'm not a normal person." That moment I thought, all right, I will leave the machine, but I will become good at it. So that is the time I looked around, and lucky a moment, because at that time, that particular emergency department, there was one of the ultrasound gurus of the emergency medicine field working as an emergency physician. And I told him that I want to be good at ultrasound in emergency medicine. And he's one of the leading ultrasound gurus currently. And he took me in. It took about 1.5 years of relentless ultrasound sonography in ED. One evening he came to me and said, "Ange, you are ready." I asked, "For what?" "For the exit exam. Let's do it." And he took me to a bedside. He created scenarios. I went through that. And he said, "You're fine. Wow. You will get an email from the College of Emergency Medicine soon. And you are credentialed to do ED ultrasonography."
That's crazy.
And that is my one experience. And then the latest yesterday, I'm at work. And I was encountering a situation where a patient arrived with a low heart rate. Yeah. And then while we are assessing the patient, he went into rapid ventricular fibrillation, fast heart rate. His pacemaker kicked in and managed to bring the heart rate down. So it's programmed in that way. And then I took the report, or recent pacemaker test, pacemaker check report out from March this year. It says atrial burden is 11% or 11.8%. And the resident next to me asked me, "Ange, what is atrial burden?" Which I
was about to ask that.
I had no clue what it is and what is the clinical significance of that. I said, "Look, I don't know, but if I have time today, I'm going to read about it, and I'll let you know what I learned." I had a moment to read about it. I opened up one of the leading cardiology source and read about it, actually. And not only I learned it, and I went back to the resident who was dealing with another patient at that time. I told her, "This is what I learned, and this is the importance of it." So I use every moment to challenge myself and see what I can learn from it. Every moment is a learning opportunity, and every time you learn something new, you're upskilling yourself a wee bit, but you're a better person than yesterday.
I love that. And I think it's very true, because when I think back on the sort of the 9 months that we've been working together, I would honestly say I've learned a lot from you, and you always take the opportunity and time to teach me things as well. Even just like last week, for example, when we were on the shift together, there were so many things that I feel more comfortable coming to you and talking to you about, because you're able to like sit down with me and be like, "Okay, this is this, and this is how this works." And I've always sort of respected that about you. I want to talk more specifically about stress. And that's where I want to sort of relate this, because this podcast isn't just for doctors and medical professionals. It's also for sort of everyday people who are interested in self-development, and something more broadly that I believe that you would be an expert in is stress management as well, because the emergency department is such a stressful area, and like, you know, the situations you're in are so stressful. What are some techniques you employ in real time to decrease your stress levels in, say, life-threatening situations? Like, for example, I remember me and yourself were in a resus situation, and for everyone listening, resus medicine is like the most acute medicine. Think of people who are having cardiac arrests, and that's exactly what this patient had. And I just remember you were very calm during that whole situation, and you're very straightforward, and you sort of direct everyone to their role. And I think that's something I really look up to in emergency staff specialists, and especially yourself, is how calm they can be in a really stressful situation. So how do you think you make yourself more calm in those scenarios?
To be honest, I'm not calm inside.
But you don't know. But I think the thing is that you don't look stressed at all. You look very calm and collected. And I think that bleeds into everyone else in the room. And so then we can, because we look to our leader. We look to our leader and say, how should we act? And if the leader's calm, then we're all calm as well.
Leading the resus scenario is a skill. It's an essential skill as an emergency physician. We've been trained into that. Emergency medicine training is the longest training in any specialty, 7 years in total.
Really?
Yep. So you have 2 years of basic training.
Right.
Minimum 12 months of professional training and 4 years of advanced training. So that's the longest advanced training. So it is essential, because these skills, you can't learn that from textbooks. What you're exactly doing right now is what you have to do. You need to look up to someone who's doing it rightly, and then learn from that and put yourself into that too, and invent your own way of doing it. It could be meditation, it could be breathing exercises, it could be something like that, but to get yourself calm into resusc, because it's a messy area. Emergency medicine resuscitation room is highly uncontrolled situation, and you need to bring that under control. To do that, you need to have that particular mindset to bring your entire team into, and that is not something that you're born with, that you have to earn that skill. So my strategy, I process things in my head, but I do not show that out. It's probably I learned or practiced and achieved. You're not the only person telling me that one. So in many instances, people say that, how did you manage that situation like that? Nobody knows what's going on in my head. So I can't say it's a kind of meditation just before that.
Yeah.
However, when I walk into resuscitation room, I go into kind of trance, semi-conscious. I wipe everything out of my head. And before that, I delegate my duties to someone else. Because as a team leader in the emergency department, you have many other jobs to do. And so once you walk into emergency situation, you can't keep all these responsibilities on your head, because you have only one focus. So it's like you were given a bow and arrow, and they show you a parrot on the branch of the tree. Your instructor asks you what you can see. I only see a spot just above the parrot's eye. I don't see the beautiful trees around there. I don't see the sun setting at the background. Nope. I see only one spot just above the eye. So that focus is essential inside the resusc room to keep everything together. And it's very stressful, but if you keep your outside calm, we will not bleed that stress into others.
Yes.
That's the most important thing.
Yes.
You always have the time after resusc to vent.
Yeah.
Maybe 5 minutes until the next resusc come into room. Maybe half an hour. So use that space to vent out. Sometimes I have to go home and vent out. If you ask my wife how many times I go home and tell the story to her, and sometimes I cried at home. But I do not let that come out during the resusc, because if I let that out, the entire team will collapse.
Yeah.
Because being a team leader in the resusc is hard, and it's everyone is looking up to you, and you need to be that clear. There shouldn't be any doubt in there. If you have that mindset, train yourself to that, you'll be a good team leader in the resusc room.
The only time maybe I felt a flicker of that trance-like state that you're describing, it was in resus, and it was another sort of cardiac arrest. And I remember feeling, I think it was one of my first cardiac arrests actually, and I remember seeing the patient, and the patient was the same age as like my father, and then came in, and for some reason, for like a few seconds, I just sort of went out of it and started thinking, oh, what if my dad has something like this? What am I going to do? And then I was like, what am I doing? I need to there's a patient unwell here. So I switched back and then just turned that off and then just did my job. And I think that's what I can relate to in terms of what you're saying. Maybe that's the same feeling as this trance of just switching off and just doing your job no matter what your sort of mind is telling you about. But it was very hard. So I'm sure it's going to take a lot of practice to get much, much better like your level is.
More you do it, more you get better at it.
Yeah.
It's hard at the beginning. And emergency medicine, you encounter these things every day. And it's always your brother, your sister, your parent, your kid. It is the case. In particular, when it comes to kids, it's very traumatic experience to everyone, those who have kids or younger brothers, sisters, because you always relate it to your own loved ones. And not every person inside the resusc room the same. Some have strong minds, some don't. That's human nature. And you have to manage that human resource well as well. Some situations, a couple of your staff start crying or falling apart inside the resusc room. You have to take them out for the best interest of the patient. But you have to look after that staff member as well. It's part of your job.
Yeah.
It happens often, quite often.
I want to come back to that if that's all right, because I do have a question for that later. Just focusing more on the stress sort of component and the real-time strategy. So when you're in that situation where something acute is happening and a patient is deteriorating, what are you telling yourself in that moment, or what's your breathing like? Are you focusing on taking nice, calm, deep breaths, or are you just so focused on looking for the cause or the next management in this patient sort of thing?
What I always tell in my teaching programs is there are things in your practice or clinical practice that you have to do with your spinal reflexes, because you have to process a lot with your higher centers. So you have to spare that part and get day-to-day things into your spinal cord.
Right.
Let them happen in reflex.
Yes.
So these things with practice, you eventually get it into your spinal cord.
Meaning you practice it so much that it just becomes automatic. Right.
And then you have a lot of time and space in your brain to process things consciously, being mindful all the time. Again, as I said, it comes with practice. It's not that something you got from your genetics. But you can hide away from that as well. So if you hide away, you still can survive under the radar, but it's not good. One day you will get caught up in the situation and you feel that, all right, I haven't done this before, so now I'm stuck.
So say when you're looking at a resus call and all these things happening, are you thinking about I should be taking nice deep breaths, or that's not even on your sort of radar? Or
I may be doing it with my spinal reflexes.
I see. So you just trained it in your routine.
When I get that resus call, I may be doing it. That's probably how I keep myself calm in there.
Yes.
And get my focus into that. I did it consciously at the beginning. And now I don't feel much.
Right. So take me back to in the beginning, because you were saying that not everyone, and you were saying yourself included, is great at handling stress initially. So when you weren't good at handling stress, how did you handle stress in those scenarios? And how did you improve it? What did you practice?
One good thing in emergency medicine is that you have multiple personalities around you, like at the same level of experience. So I have felt the tribal feeling. We all tribes some few million years ago.
Yeah.
That tribal instincts come up. So I always call emergency medicine is a tribe.
The staff or the department?
The entire staff.
Right.
So we all kind of tune into same thing every day, and we have different level of experiences. We have elders.
Yes.
So you always have someone to turn up to. It doesn't necessarily need to be an elder. Maybe you're a junior most intern on the floor. They have brilliant light bulb moments. So I never felt that way at any moment that I'm alienated in that situation where being center forward or striker in the soccer team, that you once in a while get ball towards you and you have to kick the goal. No, I never felt that way. I always felt supported. Yes. And that feeling gives you the confidence.
I see.
And then whenever you get stuck, there is someone else always behind you to tap on your back and say, hey mate, let's do this thing now. And it happens all the time. I can bring up many instances in the research room. Someone tap on your back and say, why not we do this thing? So that advantage is in emergency medicine always.
That's so interesting. I've never thought of it like that. I think that's a really good point.
I never felt pressure to do all by myself.
Yeah, right.
So that's called delegation. You delegate the jobs and you trust your team and you believe they will deliver what you want. And if you do not see them delivering, you can always correct them because you see the whole thing. And we always have room for improvement anyway. So every time at the end of the research, we do warm debriefing and we discuss immediately what we could have done differently.
I think that's huge. I think whenever I think of stress, it's always like, how can I deal better with stress? But I don't think of how can I ask more for help and get help from other people in regards to that stress. That's a really good point. So just sticking on the topic of handling stress, is there anything you do on your days off before work or after work that you think helps you deal with stress? The reason I ask is because I read this book of Michael Phelps, and he's like an Olympic American swimmer, and he had this sort of a pre-game routine where before he has his training, he has like a whole routine he does on his days off, or even before his training sort of begins, he does like this little meditation or visualization. So I thought I'd try it out. And so for the last, say, month or two, I would notice that I would sometimes feel a bit anxious or just tired before coming to work. So I thought, okay, I'm just going to do like a 5-minute meditation before coming to work, like say in the car or whatever, just so I can feel comfortable with the environment before I go into the shift, if it's going to be intense or not. And I don't do it consistently enough yet, but I think it sometimes helps. Like sometimes I do feel like I'm glad I started the day off calmly, so that when these hugely stressful situations happen, I can always come back to this like baseline of like, okay, I'm calm, like just come back to that. And then when these big stressful things happen, you just always come back to yourself and be calm. But is there anything you think you do on your days off or before work?
It's hard to say, but I think everything I do when I'm off is around my family. So getting back to my family is a very calming thing for me. Even after a stressful day, if I can come back and hang around with my kids and my wife and all family members, gives me a lot of relief.
Yeah.
Every time I get stressed at work, I call my wife and said, I'm really stressful today. It's a very hard shift. Let's go for a drive tonight. Sometimes it's crazy.
Yeah.
We get out around 8 p.m. in the night, go for a 3-hour drive, come home after 11:30. We do not stop anywhere. We stop by 7-Eleven to get a cup of coffee, couple of donuts to kids, and we just drive. Sometimes you end up in driving, 150, 170 Ks.
It's almost a Canberra at that point.
So it's gone on to extend that when I call around 4:30, 5 o'clock to my wife to see how things going, just a routine call, she asks, do you want to go for a drive tonight?
She's trying to decide, does she need a pack for a 150 kilometer trip?
So she knows that.
Yeah.
So if I do not come out with that idea, she asks me, do you want to do that tonight? It's kind of asking, are you okay today? The shift is being okay? So if I say no, she knows that. So I do it a couple of times a week.
Yeah.
It relieves you a lot. We call it seeing cute animals because my little ones, they like to see all wombats crossing the road, rabbits, tiny animals by the road in the night time. So we call it cute animal watching. So strategy is to see at least 3 cute animals a night. So that's
a formula.
That's one strategy that I use to relax myself after a long shift. I also have a different skill. If I lose my job one day as an emergency medicine physician or as a doctor, I can still survive. I'm a carpenter.
Really?
Yes.
Actually?
Which my wife hates.
Why would she hate that? That's so useful.
Because I have a stash of wood at home and I have a full workshop at home.
Right.
So I make things.
What do you make?
I can make any furniture.
Could you make this table?
Yeah,
this table's okay.
I did one last week for my mom.
Yeah.
Just one day, last Tuesday. Morning I started, and evening I finished and painted for her sewing machines.
Like a little table?
Little table, like about 3/4 size of this table.
That's sick. So wait, did you learn this as a hobby, or was this something that you learned before?
Go back many years. When I was in year 8 or 9, my then house, my parents' house in Sri Lanka, needed repair. Some kind of addition to the house. With family getting bigger. So there were a lot of carpenters and builders working around.
Yeah.
I started falling in love with this wood thing. So I learned from them, watching them.
That's so cool.
And then in the school we have the subject as woodwork or carpentry, cabinet making for the year 9, 10 and 11. And I learned it from that aspect as well. So basic skills. And the rest is just I learned from internet and so on.
That's so cool.
And I did my own kitchen at home.
You did your own kitchen?
Yeah, and did garage cabinets and all done by myself. And so when I have a free time, like 2-3 days of off, this is what I do. And it's kind of a meditation. You just cut wood, drill, screws, hammering.
Because it's very hands-on and
you're completely out of medicine. So except the orthopedic surgery. That's also carpentry. But no, it's completely, my head goes away completely out of medicine for that time. So you need to have some other interests, like maybe photography, maybe something like that. Just completely switch you off from medical side to relax your head. There are certain situations you need that space. You get overwhelmed. That's true. It's human nature.
I think for me that comes from like swimming or running or going for a bike ride.
It could be something that distract you from that main cause and have your own moment, your own space.
Thing that just completely switches off.
Yeah.
Maybe my more unproductive ones are like playing video games.
Well, one can call it an unproductive, but it's only a person who does it know what productivity it brings. It may be just reading a newspaper in your toilet for 1 hour. That's crazy, but
it refreshes you enough for your job so you can come back. Yeah. No, that's a really good point. I think something I've noticed that I'm starting to sometimes struggle with is after a really busy shift, say even just last night, for example, it wasn't busy, but it was just intense. There were a lot of things going on. And you come home and you try to fall asleep and my mind is just sort of running because it's, you finish your shift at midnight, you get home at like 12:30 and then you're like, okay, I need to go to sleep now. But then you're still thinking about, oh, should I have done this with this patient, or should I have done this, or I should have been better in that. Do you have a way that you are able to sort of switch off quickly for sleep? Or is it that you think that just comes with experience, that you just get better at switching off?
You become better at switching it off with experience. That's being a normal human. Be happy about that. And that's a good thing that you feel like that way. So you always, push you to be better next time. That's a good thing. If you're a completely senseless person, that's not good. That is lack of insight.
I mean, you get to sleep quicker though.
Not really. So it's not a good habit though. When I finish my shift at midnight, I can't fall asleep up until for another 2 hours actually. Yeah. So sleep is one of the most important thing in my life. I want to sleep at least 6 hours in a row. Yeah. Otherwise the next day going to be tough for me. And so if I have to finish my shift at midnight, I get prepared for that. So I know I'm not going to go to sleep up until at least 2 a.m. So I do not book anything or plan anything before next day 10 o'clock. So I know that I need that space.
Yes.
Sometimes it's hard when it comes to family, a balance of work and family things. That's why you need to share the burden or share the situations. Yeah. If you're lucky enough to have that support, which I am, so I make sure that I get my essential things. It's not easy to switch off. Yeah, you always feel inadequate. That's natural. So could have done better. That's normal. I'll get better at it. Guarantee.
Eventually. And I think you'll do less sort of evening and night shifts as well as you get more senior as well, right?
And then get other responsibilities on home.
More things to stress about. Yeah, I don't know. I think it's a hard one because I think sleep's really important to me as well.
It's very important. That is the time you heal yourself.
Yeah.
It's a whole day you get traumatized, and that is the time for yourself to heal yourself.
So I guess I want to dive into that sort of trauma that's happening at work. What have been some of the most difficult or distressing situations or moments you've had in your career in emergency medicine?
Yes, always, having a sick kid in front of you as a parent is really a stressful situation for me, and it's very personal as well.
Yes.
I myself never had to go through that, but I always put, as you said earlier, so we put ourselves at that situation and start thinking. And coming out of that is something that you get with practice or experience. If I take an example, at one day I had a 4-year-old child just after Christmas Day. This was a Boxing Day. Brought in at the same age as my little son, 4 years old, quite unwell. Brought in by parents, 3 days of fever. At a glance, we knew that this child is in a very bad shape. taken him to resus and started resuscitating. Couldn't get a good IV access in. We had to do intraosseous line. Got fluid in and antibiotics given. 1 hour into resus room, he went into cardiac arrest. We continued to resuscitate for 1.5 hours with the help of pediatrician, the neonatal transport doctors. After 1.5 hours of relentless effort, we failed.
Sure.
He passed away. So that moment was one of the most striking situations because my son was turning 4 in another week or 2 time. So I managed to lead the situation, but during that resus, the parents were kept in the room all the time. So they saw what's going on. I can still remember the pediatrician was scratching his head to think what else we could do here. Nothing was successful. And then I had to break the bad news to the parent because they didn't know what's going on. They didn't know what happened just now, seconds ago.
God. Yeah.
They were in the room.
Yeah.
I did that. The pediatric specialist came with me and the nurse in charge came with me. I had to give the ultimate word. Parents didn't cry because they were kind of numbed to the situation. And walk out of the family debriefing room, and I saw 4 nursing staff were crying as well. I had to speak to the nurse in charge of the floor and then get those nursing 4 staff out of the work because they were not able to continue, and then we were short of staff for the rest of the day.
Yeah.
I didn't know in the middle of the resus, one doctor apparently walked out, one of the junior doctors, because that particular doctor's young brother died many years ago, and that doctor started getting flashbacks from it.
Oh my God. Wow.
Which I got to know later.
Yeah.
So that day was my worst day. So having that experience so personal, up close to myself, and having 5 staff already struggling through. And I have about 6 or 7 hours left in the shift as well, which I cannot go home. I did finish the shift, went home, and I didn't go for a night drive on that day. But I told the story to my wife, and I cried at home. That's the day that I cried. It's the only day I cried after my shift because I couldn't keep it to myself. That day was so overwhelming to me. But I managed to finish 10-hour shift. When I went back to work a couple of days later, the first thing the nursing staff or one of the nursing staff asked me, "My God, Anj, how did you be that calm and control yourself in that room for that 1.5 hours of resuscitation?" I couldn't believe it. Everyone was crying inside and you were so calm and focused on tasks. I said, "No, I didn't. I was crying inside, but I couldn't show that out. If I do that, the whole process will fall apart." And I told her that I went home and cried. I'm also human. So that control, I don't know, it happened. And I always reflect on that case. Whenever a difficult situation comes, I always telling me, "You did that on the other day. You can do it. You can do it. You can do it." You did that. The most difficult situation, that was about 4 years ago. I always bring that out. You did that on that day. Today you can do it.
That's amazing. I mean, we spoke about this story before as well, but I remember when you told me it, I was just so sort of taken aback by it. And weirdly enough, it sort of made me want to do emergency medicine more because I got to see a really strong example of what a good emergency consultant can look like. I felt like you were really making a difference. Like, even though it wasn't a good outcome for the patient, you guys tried your best. And I think what that required from you and what it required from the other staff members as well was huge. And of course, it was devastating for this family to go through as well. But being part of that and trying your best to help that patient, I think feels so fulfilling in a way that we get to be a part of this experience. Like, we get to try our best and try and help these people in these sort of situations. But that's amazing. I'm lost for words because I think it's such an amazing sort of experience that you went through with it, and hopefully I can work towards that one day as well with lots of practice. Yeah, that is crazy. So then how did you come home that day, and then was it sort of a long time that it took to heal from that, or do you think it was just eventually you just sort of say, okay, I've just got to do my job now?
It's still there. The scar is still there.
Yeah.
When a kid comes with unwell situation,
Yeah.
I just cannot stay focusing on what I'm doing right now. I just put myself in there. Sometimes it may not be my patient.
Right.
Maybe someone else, some other teams, or maybe team A, B patient, I'm in team A. I always poke my nose in there. I just want to make sure that things are happening in the right way.
Yeah.
And help my colleague out.
Yeah.
So I have that habit now. It's probably started from there. So I just keep that case in my pocket all the time. I want to deliver better, knowing that you can't do it every time.
Yeah.
There are failures, but once you've done your best and it failed, you at least have a satisfaction. You've done your best. Can't do any more, and that's it.
I find this part of medicine really interesting, that some of the most beautiful or impactful moments of medicine are generally the moments that are the most painful as well. And I've noticed that, so like one of my first rotations as an intern was cancer medicine, so med-onc. And I remember seeing so many patients, and a lot of them would die, and some of them you develop relationships with because you see them every day for like 12 weeks. And there's still moments now when I think about those patients, and at the time I wasn't really happy with it, in the sense that I was just so upset that all these people you would see firsthand pass away. But then now when I think about it, I think that's such a important moment in my medical career, because it helped me sort of really try and understand these patients and like understand what are we doing? Like, we're actually looking after someone's life. And so those moments are devastating, but weirdly enough, they're also some of the most beautiful moments of your career, for me at least. And it sounds like for you as well, that was a really important moment in your career. And it helped define sort of your practice now. But that's really interesting. So inversely from that, what were some of the most rewarding moments in your career?
Not long ago, this is something that we do not often do. You can't find someone who done it before oftentimes in your group or team. A patient came in with presumed anaphylactic shock. Those who know the situation where they get swelling in the throat and they struggle to breathe, and eventually their throat closes off if we do not treat in timely manner, and they can potentially die of it. So we have minutes to decide what to do. And this particular patient was in his 50s, turned up by himself because he had itchy throat. And within minutes, he went into this situation. Taken into resus, and at that moment, there wasn't anyone else who could help with this airway. The anesthetist was not able to get the tube down the throat and manage the airway. The patient's oxygen levels were dropping so rapidly, and it was a peri-arrest situation. At that moment, I was lucky enough to involve in that resus, and I managed to get the airway secured by a last resort, that is, we call emergency cricothyroidotomy. So I was the one performed the procedure, and patient's life was saved. 2 weeks later, patient went home, and another week later, the patient came and gave me a hug. At that moment, only I knew it was one of our staff members' parent. And that particular day that he came in, that staff member was on duty as well. And I didn't think about anything else. Everyone asked me when I walked out after doing the procedure, how old was he? I said, I don't know. I didn't see anything else. I saw only the prepared neck in front of me. I didn't see anything else. Was he blue? Was he pink? I said, I didn't know. I just saw only one thing. I saw the neck. I saw the beautiful neck open up, and I saw a scalpel lying next to me. Yeah. I saw the tracheostomy kit open up next to that. Yeah. That's all I saw in there. I did that within 2 minutes, and I walked out and gave the patient back to the team.
Yeah.
That's all I saw. But that was one of the very satisfying moments, especially when you see that patient went home 2 weeks later with no single IQ point lost. I mean, no hypoxic brain injury. Yeah. And he's back to work in 2 months' time or so.
It's amazing.
So that's on my duty. Another moment, I want to take the opportunity to tell what you can do as a human being. During COVID time, it's a global crisis. We were working really hard in our department to make sure that the COVID patients are looked after well, with dignity. We are lucky enough to be one of the best health services in the world to have minimum number of deaths and complications as a whole in Australia. It's everybody's contribution. But some countries were not that lucky enough, where my birth country, Sri Lanka, was one of them, struggling through because of lack of resources.
Yes.
This is very, very personal experience. I involved in managing the critical care ambulance service in Sri Lanka for 2 months.
Right.
So at that time, they were at infancy, the ambulance services, and they had limited number of services available, but demand was so high. So they wanted to have a system to manage this more effectively, to minimize the burden on normal ambulance services.
Right.
So they did not have enough expertise at that time. Well, I don't have that expertise anyway, but with the help of one of my friends, we set up the group and managed to establish a system 24 hours to dispatch ambulances for emergencies in Sri Lanka.
Wow.
This was done online.
Right.
With the help of Sri Lanka Telecom. They gave us free contact line.
Right.
We managed to recruit 4 teams globally. Australian Eastern team, Australian Western team, British team, and US team. All our colleagues who we know from our profession. And we had 72 doctors. Most are in critical care, either ICU or anesthesia or emergency medicine. And we covered 24-hour shift, answering all phone calls from ambulances in Sri Lanka and also the COVID task force message center.
Wow.
Whenever a patient calls, they'll connect the patient to us and we give instructions over the phone.
Wow. So it's patient to doctor.
Patient to doctor.
Wow.
And we managed to bring down the COVID-related ambulance calls from 1,900 a day to 600.
That's huge. That's a third cut.
Yeah.
Jesus.
So was brought down to a manageable level and handed over after 2 months. And they continued to continue that process.
That's amazing.
The most rewarding thing I felt was after concluding the task, we, as a group, that group is not an organization or anything. We just came up for the task and then we said, okay, now it's time for us to go apart. And when I emailed everyone, okay, our job is done. We delivered what they expected from us. Now we are handing over that back to Sri Lankan authorities and it's time for us to have rest. I received one particular email from a British doctor which I never knew. And she wrote a letter that I will never forget. She said, right now I'm typing this letter while I'm in the hospital on a bed. And she said, I was diagnosed 4 months ago with breast cancer. And I got a couple of more months to live. And you gave me the most beautiful opportunity in my life to be in the hospital bed receiving chemotherapy. I was answering those phone calls from people in Sri Lanka.
Jeez.
And she said, I probably have 2 more months to live. Thank you very much for giving that opportunity.
That's amazing.
I don't know even who she is even today. I don't know whether she's alive now or not. But that was one of the most beautiful moments as well. And I felt giving help to my country, my birth country, one thing, but this is probably the most rewarding part of it.
Yes.
If I made one person's life beautiful through that.
I think that's amazing. That's incredible. And we're so lucky in this profession to have experiences like that. It's beautiful. And it comes back to that sort of thing I was saying before, how some of these most painful experiences I feel like we have in medicine end up being the moments that you look back for in years and be like, that was a beautiful moment. That's amazing. How do you think that experience has changed your practice now today?
It's every day. So it's doing that for someone and they're smiling, they're walking out with happiness. That's the rewarding thing. You don't want a bottle of wine or chocolate from them. That's happiness. Somebody is comfortable after your treatment. That is the ultimate goal.
Yeah.
So always I start my work every shift thinking that I will make someone's life better today. which one way or the other. Maybe your loved one is passing away, but without suffering, without pain. That's also a beautiful thing.
I agree. Absolutely.
Medicine is not always curing someone or making them live one more day. No.
Sometimes it's about making them comfortable. Someone once said something quite beautiful to me. They were saying how, I think it was during my oncology term, they were saying how they better deal with death. Because I was saying I sometimes find it quite overwhelming. And they were saying that at the beginning of life for everyone, there's doctors and nurses there. And then at the end of life, there's doctors and nurses there as well. And I found that quite a beautiful thing to say, because I remember as a junior being like, oh, like, why are we always surrounded by death? We can't sort of, like, I hate this. Like, we're so overwhelmed with death. But then now I see it as sort of this beautiful thing that they're sort of returning to where they sort of started, and we're passing them on to wherever they go next.
Just take your example that when you were doing your oncology, so you get more familiar with those faces, and then you get friendly with them for their last few days of their life, last few weeks of their life. Think from the other person's life or their side, how beautiful it is to have such a nice person like you as their last friend. Think that way.
I don't know if I'm that nice, but fair enough. One of the other difficulties I've noticed in the workplace sometimes can be that there can be a lot of workplace conflict, and that can be either from me calling another consulting team and there's some conflict there, or it also just can be there's a really verbally aggressive patient, or someone in the department is just being sort of really non-compliant. To give examples, I always try and tell people how ED is like, because when I tell people ED is 4 days a week, they think that's really chill. And I say, no, it's not actually. The emergency department is like working at a rock concert, and it's very loud and there's people screaming everywhere, and you have to sit there and study for the most hard exam of your life. That's what ED feels like to me. And so part of that sometimes is conflict. And so in that environment, how do you deal with that conflict when it does arise? Because it does eventually arise. Everyone has their own interests, or between patients or between colleagues. How is it that you approach that conflict normally?
One way of handling those situations is to be mindful about other sides' mentality. When I pick up the phone to call another team, I always take a few seconds to think what other person might be doing at this time. Whether that person in the theater busy with another case, or seeing a critically unwell patient in the ward, or maybe got shouted at by a family member. There are many situations. So if you adapt yourself to that, you pick up the phone most of the time, because we do phone consultations nowadays, or referrals. You have space to accommodate that person's grievances. So if your conversation not going in the right direction, always set yourself back to the page and think, oh, maybe that person is tired. Because we are all professionals at the end of the day. We are all grown-up adults. We know that social norms are always there. The ethics are always there. If someone is deviating from that social norms and ethics, there must be a reason.
Right.
We are not, mentally ill or incapacitated people, right? We are all normal human beings with higher mental capacity. So if you think that way, you can adjust yourself. You can take a step back, and sometimes you can be the losing party in that conversation. It doesn't cost you much. You either probably can redirect the conversation to right direction, or you can stop there and restart later. So that's one way of handling those kind of conflicts.
Yeah.
Because when there's a conflict happen, it does not move any further. It doesn't go the way that you want it to go. So no matter how much do you try, and on top of that, if you become also frustrated, best is to stop. Take a step back, and if possible, restart. If not, go for a different strategy. So this is a situation where we often test our trainees on as well.
Right.
in exam situation.
Right.
We get these artificial scenarios where you are going to talk to a frustrated orthopedic registrar.
I actually, for orthopedics on their side, like, they've never been mean to me. It's normally other specialties that are mean to me.
Let's take an example as orthopedic registrar.
Yeah.
Their training is one of the intense trainings on the planet. Particularly in the latter part of their registrar job or advanced training job. They are on call 24 hours, working 7 days in a row. Yes, they get probably a few days off after that. But closer to that day 7, they are tired. They haven't slept well. They haven't eaten their meals in time. And they've got a couple of surgeries gone wrong during that time that your boss shouted at you. Taken over medical cases, and the orthopedic doctors got no clue how to manage them. I always think that way when it comes to Friday, Saturday, when I make a phone call. I know that is hard. So then if you move on with that knowledge, if they get a bit of a upset from the other end, I won't get upset. I know that person is tired. So I would take a different approach in that situation.
Yeah.
So know other person's difficulties as well. So be empathic and also put yourself at that situation and see what you would do.
But I guess, Ange, what if I'm tired?
That's true.
What if it's, I remember a situation where it was like 11:30, it was like 30 minutes to the end of the shift, and then I think it was a gen surge reg was like, call me back in 30 minutes. I'm like, oh my god, my shift ends in 30 minutes. What do you do then?
So next thing is that when I say stop and say, look, it sounds like you're very tired and you're probably not getting what I'm saying. I'm trying to say this thing. And if you can start the conversation again in a fresh point. Most of the people come back to page. The other person, if that person has the insight as same as you, that probably I was a little bit rude on the phone with this person. If that person is also ready to restart the conversation, that's fine. It's beautiful.
Okay. All right.
If that is also not going the right direction, that is to say, okay, full stop. So you don't want to make the things more sour. Just stop there, because it's not going to get any benefit to the patient anyway.
Yeah.
You have to learn to yourself, so because you're tired too.
Yeah.
I always talk to a different colleague then.
Okay.
Or either talk to my colleague and say, look, I had this conversation with a particular person. It didn't go well. Can you please help?
Okay.
Or I would call the other colleague of that person. I would say, look, it's not going to go that way. So I would speak to the consultant directly. Right.
Okay.
But if it goes that direction with the consultant, it's difficult because there's no one else to turn.
Yeah.
That option is always there.
Yes.
Third thing is always communicate this situation to the appropriate people. So you need to let your director or your department head know. And also, if possible, have a fruitful discussion with that person who you had the bad experience with in a different time. Simple email, work email, saying that, I had a conversation with you the other day. I felt this is what happened, and I wonder why. I would like to have a nice talk or discussion with you over a cup of tea or coffee. I'm free next Thursday, 10 o'clock.
Right. So try to amend that.
Yeah, if you're happy to come and talk to me. This is a professional approach.
Yes.
We all act sometimes impulsively.
Yeah.
We kind of, especially when we are tired, we act with emotions. After a couple of hours, you felt like, I shouldn't have done that this way.
Yeah.
That way, so should have done differently. We all have that remorseful situation or regretting moments. That's why I say when you try to write an email or type it but don't send it. Yeah. Type it and keep it as a draft. Read it next day.
when things have calmed down.
Yeah. And sometimes you can make that letter better as well. So email better words.
Yes.
I always do that. I draft it and leave it and have a look at next day.
I really like your idea of having a sit down and talk with this person who's, been short with you. I think that's like revolutionary for me, because I thought they're just sort of like a voice on the phone screaming at you of like, why did you call this team? And I'm like, I don't know, we just thought it'd be appropriate.
Over the phone consultations are always you can hear only the voice. You can't see the body language, facial expressions, gestures.
Yeah.
posture, how they kept their arms, legs crossed or not.
Yeah.
So it's very hard. You don't know the person's mindset at that time. So that's why you've got to be very careful over the phone not to judge what's happening on the other side, because you can't. You don't know. I find it's always good to have face-to-face talk. It helps to diffuse situations quite often and get to know each other as well. And next time the conversation will be much pleasant over the phone, because now the other person had a cup of tea or coffee with them.
Yeah, I think that's huge.
Yeah,
I think that's huge. I think the thing that I'm noticing about an emergency department and just emergency medicine, because it is a career that I'm interested in, and I guess one of the things I sometimes worry about is, will it ever be difficult for me to balance work and family life and personal life? Because it is such an intense field and it is such an intense medicine. How do you think you manage it and balance it? Do you think you manage it well, or is it sort of difficult at times?
You need a lot of understanding within your family, because you're doing shift work.
Yes.
So that is one of the things in emergency medicine. You're working at least 1/3 of your time after hours. So you miss significant amount of family time. So you need to adjust your life according to that, give that missing time back to your family. Should do consciously. When it comes to emergency medicine, after you becoming a specialist, when you choose your workplace and number of hours you spend on travel and all sort of things need to be done with this thing in your head. The time you miss with your family, you can't get it back. The kids grow very quickly, and no time they will be in universities and they will be leaving your house, and you will miss entire time with them. After that, you will not get that back. So if you do that consciously, you will be able to manage it. One good thing about emergency medicine is, yes, as you said, only 4 days a week you work, 3 days of the week you are free. You can manage that free time very effectively compared to 85 job that you work on 5 days a week, where you have only the weekend free. The other thing is, emergency medicine, once you done your shift, you go home free. You don't need to take your work or patients home. So no one is admitted under you. As long as you've done your job within your 10-hour shift right and handed over to your colleagues safely, no stresses. And you can easily switch off from your work for the rest of the day, and it's a good thing. Emergency medicine is something that you always help someone when they are in trouble. They come to you because they don't have a choice. If you are a heart specialist, they can choose you. They can say, Dr. Angie is not great at cardiology, so I will go to Dr. Hamza. He's a better one. But if I'm an emergency physician, the patient come to me when they are in most helpless situation, and they can't choose me over you. So you got to be good.
Right.
That satisfaction is always there to me if I finish my job of the day without much hassle or problems or things. I always have the satisfaction in my head. I've done good for somebody. And it's a very cross-sectional encounter. We don't have any follow-up patients. So that is also giving you the mental capacity to recover and put more time on your family. The balance-wise, again, I don't know it's a good thing or bad thing. We don't have private practices. Consultations. Whether you like it or not, your spare time you have to spend with the family. You don't have your rooms to do private consultations, and the weekend sometimes some of my friends do weekend consultations. They're not at home. Here, good or bad, I don't know, but we don't have that.
Good.
So your free time is you're actually free.
I love that. I really love that. Like when I work, I want to be at work, and then when I'm not working, I don't want to think
Don't
about
take work home unless you really want to,
exactly.
need some relaxation, talking to your family about incident. Like as I said earlier, fortunately those things won't happen quite often. Rest of the time, leave work at home, workplace and go.
I love that. Ange, thank you so much for today's conversation. I found it really valuable and really insightful, and thank you for sharing those stories. I told you this during the interview, but every time I hear those stories, it sort of makes me feel more inspired to do emergency medicine, because I think it's really affecting, and like you said, it's very hands-on. You get to see the result of your work. But thank you for sharing your lessons and journey with me. It was really a pleasure to share this with you. Thank you so much.
Thank you very much for having me.
Yeah, of course.
And all the best.
Thank you.
I'll see you as an emergency physician.
Hopefully we'll see. All right, thanks, mate.